Beaver Lake Health Center. We're dynamic. We're First Nation Health Center here in Treaty 6. We're about 2.5 hours northeast of Edmonton. Beaver Lake's nested within 6 different First Nations around here: Cahiwin, Frog Lake, Saddle Lake, Heart Lake, Cold Lake. We're all within like 100 kilometers of each other, and our people move all over. We're all over the place, so it's often that we get, a baby might be born here, but might move over to Cold Lake. We have currently roughly around 600 Nation members that live here and that we deliver health services to. We love working for our community. I think one thing that we're really proud of here is that all the nurses are from Beaver Lake. We're band members here. Our primary care is limited to the scope of our nurses. And so immunizations and community health is a big part of our program. There's just a lot of barriers in general with our immunizations, like education, coming to the health center, just knowing the people in our community who are due. Like I said, we were using paper charts, so it was harder to keep track of who was due.
It's harder with paper charting. You'd have to call other reserves to get information. You'd have to call public health to get their information. With CHIP, everything's in one place now.
CHIP had been here for many years. It wasn't really utilized by the nurses at the time, and that was because one of the main barriers was because the data ownership and control and the privacy with our leadership, just questions about if this is something that we can protect our community members' data and we own it. And that's one thing with Okaki and CHIP is that they've worked a lot to build that trust with communities and make sure that they are aligning with the OCAP principles. We're giving over 1,000 immunizations in a year, and compared to just before COVID, that has grown exponentially. A big aspect of why we've done so much work in the last 4 years to improve those immunization rates to get them to where they are now, because we've built that trust and relationship with the community. And then having access to information makes it easier on us because we're not having to waste more time to track that information down, like having access to provincial records, because our people are very mobile. It allows us to, for them to identify people that need immunizations and then bring them to us.
And not to mention the integration with NetCare, that's huge.
Getting NetCare has been life-changing in a way, because without that integration for COVID, it would have been a completely different story.
When I get phone calls from the hospital, I could easily look for those before it would take, I'd have to call them back the next day because I took some time to go through the paper charts to find all that information, calling other reserves for that information as well. It's made things easier, and it's just been better.
With CDOM, the communicable disease management program that's integrated into CHIP now. It's too bad we didn't have it up and running at the beginning, but for our sexual health clinics or STDIs, contact tracing for any of those, it's really helpful. We're just getting into expanding that service. We just got a mobile health clinic van, and so CHIP is going to be really instrumental to our contact tracing with our communicable diseases or any notifiable health stuff, because it's right there. And so it allows us to track and have all that information in one place. As many of us have learned in the pandemic, contact tracing it's an easy way to overburden our very fragile system. So with CDOM, it really kind of alleviates a lot of that paper mess that was happening. It's hard to say what CHIP is in one word, because it's so much more than immunizations. It's like a wraparound community health, tool, resource, asset that I think Okaki in general is protecting our data and allowing us to use it too. So it's not like our data is just being stored in here. It's not just something I can look up someone's immunization. I could show you and look okay, so this is what the outcome of something I implemented is. You've seen that graph, and our rates have exponentially grown. That to me is showing, okay, whatever I'm doing is working. So CHIP and the ability on the the analytics side is, allowing us to take that data we're giving Okaki and use it for our own benefit, for our own program evaluations, and how we can be improving or where we're doing really great. I think when I first started, they said, like, your community is only as healthy as your nurses. And us being from Beaver Lake, we're able to see the needs and be like, okay, like this, we can deliver this. We give compassionate care. People want to come to us. They want to see us. We have like so much trust in the community. And I love our job, and I love things that make my job easy.